A new study is raising concerns over the Pfizer vaccine's ability to protect people against a particular variant. Israeli researchers saw the strain first detected in South Africa at disproportionately higher rates among people who received 2 doses of Pfizer's vaccine compared to a group of people who were unvaccinated. They say the data suggests the variant may be better at, quote, breaking through the vaccine's protection than others. Pfizer has not commented on the study. For more, let's bring in Carl Zimmer. He writes the New York Times Matter column and is also the author of the book, A Planet of Viruses. Carl, welcome. So the headlines on studies like this can be unsettling. How significant is this Israeli study?
I think that we shouldn't get too panicked about this. We already knew that this particular variant, B.1.351, might be able to escape some defenses that vaccines could create. But these vaccines are actually very powerful, and so the breaking through you described is pretty minor, actually. The researchers found that really they only noticed it in the first couple weeks after getting the first dose, that there were a few extra of these B.1.351 cases. So, and people also have to recognize that even with other forms of the virus, some people will still get COVID. These vaccines are not 100% effective against any of these coronaviruses. However, they are highly, highly effective. And it's important to remember that they also dramatically reduce the risk of being seriously ill from COVID, to have to go into a hospital, for example. This is, it's important to keep an eye on this kind of data, but we should really, take a deep breath and recognize, as the scientists who did this study themselves said, this is all the more reason to get as many people vaccinated as quickly as possible.
It's such important context, Carl. Well, on Friday, the U.S. Marines became the first military branch to release vaccination data. Now, CNN reports nearly half of all U.S. Marines are declining to get vaccinated. What is behind vaccine hesitancy among not just military, but healthcare workers?
Well, that's going to be something that's going to be challenging to work out, because, you can't just sort of make a bunch of assumptions about why people feel the way they do. People have a lot of different reasons for making these sorts of choices. In some surveys, some healthcare workers have felt, well, maybe I just want to wait and see. There may be some people who are sort of actively distrustful of vaccines, but it's really unclear. But we need to understand these forms of hesitancy and address people's concerns. If someone has questions, those questions should be answered, with the ultimate goal of trying to get as many people vaccinated as possible. Because while you might have some concerns about feeling kind of achy and uncomfortable after getting a dose of the vaccine, we really need these vaccines to help us to get out of what is really looking to be a fourth wave of infections.
Let's talk about the international response. Hundreds of millions of doses of China's vaccine have already been distributed to other countries. Now Chinese officials are admitting that it's not that effective. Do we have a sense, Carl, for how much protection it offers, and if anything can be done to boost its efficacy?
Well, China has been developing a number of different vaccines, and there are a couple that have become particularly widespread in use. There's a Sinopharm vaccine and a Sinovac vaccine, and these are basically, you take the virus and you kill it, and then you give it to people, and that virus can't make them sick, but the immune system can recognize it. It's been gradually becoming clear in little drips and drabs that these vaccines, they do protect people from coronavirus, but they're not as effective as some of the other vaccines that are out there. the Chinese government hasn't been all that forthcoming about just how well they work. We've been waiting for published scientific papers on their big clinical trials, and they haven't published them yet. So we only have some, press releases here and there to go by. So, now that they're acknowledging that they're okay. The question is, well, what now? Because a lot of countries are depending on these. If you have a vaccine that has 50% efficacy, that's still going to save a lot of lives, just maybe not as many as one that has 90% efficacy.
Finally, Carl, Brazil has become the epicenter of South America's coronavirus outbreak. Experts are warning that the nation could see as many as 5,000 deaths a day this month. What's responsible for the dire situation there, and are neighboring countries at risk?
I think the fundamental reason is that Brazil is run by someone who doesn't seem to take the pandemic seriously at all. I mean, if you look at Bolsonaro's comments over the past year, he's been incredibly dismissive of both the pandemic itself. He's been dismissive of many of the vaccines. And, with that kind of leadership, it's hard to expect a real strong public health movement to keep the infections down. Add to that they have a variant called P1, which has exploded across the country and seems to be really wreaking havoc. They're not doing a very good job with the vaccine rollout either. So it's a tragic combination of mismanagement and new variants. This is terrible for the people of Brazil, and it's terrible for the world because P1 is now in many different countries, including the United States.
Tragic really is the word. Carl Zimmer for us. Carl, thank you very much.